The latest recommendation for parents from the American Academy of Pediatrics is all about birth control. The method they are endorsing for teenagers involves a procedure that can only be done in the doctor's office. Fox 32's Natalie Bompke has more.
They say forget the pill. The best way to prevent teen pregnancy is this, a tiny device that has to be inserted by a doctor. Dr. Carrie Smith, who specializes in adolescent gynecology and birth control, performs intrauterine device or IUD procedures on teen patients.
Throughout the country, there are people that will have concerns about using these forms of contraception or any forms of contraception in their teenagers.
So we asked people the all-important question, is the procedure too invasive for teens?
That scares me. Why would we do such a thing? When my daughter went to college just, a month ago, we had a conversation and she is on birth control and that seems less aggressive. IUD, does it seem shocking? Yeah.
Last month, the American Academy of Pediatrics recommended IUDs over the birth control pill to prevent teen pregnancy. The American College of Obstetricians and Gynecologists also endorses IUDs over the pill for teens, and Planned Parenthood of Illinois offers the devices along with other forms of birth control.
I was in absolute agreement with that. There have been multiple studies that show that teenagers are much more likely to become pregnant on the pill. They discontinue use of the pill a lot more often than with the long-term reversible contraceptions like the IUD.
The IUD is placed into a female's body by a doctor trained in the procedure. Depending on the type of IUD used, it can prevent pregnancy up to 10 years as long as it's in place.
And so it's just a small T, this is the actual size, and it gets placed inside the patient's uterus. So this is a model of a uterus here. We place the device inside the uterus, we pull back, deploy the device, make sure it's all the way up in the uterus, and then we pull back completely. The device is left behind and the insertion catheter is removed.
Dr. Smith says the IUD does not contain estrogen like the birth control pill, so there's a reduced risk of blood clots. And she said the risk of infertility is virtually non-existent with the current products on the market. Dr. Smith says the use of a condom with the IUD or birth control pills is always your best protection against STDs.
So what is the cost of the IUD if someone wants to get it?
It's $800, but the device, the procedure, and the removal all covered by insurance typically.
As expected. Okay. Thank you, Natalie.
All right.